kids or children who are in a totally different time. You get it. Those days your mother would just give you an eye and you know this is a problem.
Hey, there are visitors.
And it's just there are visitors
and
around.
Mom gives you this eye, you know?
Yes.
Catch more of this every Monday to Friday at 9 p.m.
Again, a very good evening to you, esteemed viewer. Thank you so much for watching Church of Uganda Family TV. This is the Family Hour, empowering families one episode at a time. Adrian Austin Mukalazi is my name, your host. Today is another special day. It is a Tuesday where we discuss family health, and today a couple of weeks we are going to tackle something that is really very, very important. This is mental health. Mental health is very, very important because very many people die unaware because of depression and stress, because of a number of things. And of course, we've on this very program, the previous 2 weeks on our Family Hour, our Friday editions, we've been talking about, we've had a guest from Aruka who does rehabilitation, but you realize that there is a lot that needs to be done, especially when it comes to creating awareness, because some people don't know that they are really suffering from the different mental illnesses. Of course, later on, we shall be joined with someone from Butabika National Referral Hospital. And when we talk about Butabika, of course, Butabika is a name of a village, like your village has a name, but because it hosts a mental health hospital, people think that if you say, I stay in Butabika, then you have a problem with your head. That is not true, and please let us respect the people who live in Butabika. But also, it should be, according to a research that was conducted in 2022, it was found out that the prevalence of mental health, according to this study in Uganda, found out that 22.9% of Ugandan children below the age of 18 are mentally ill, and 24.2% of the adults were suffering with mental illnesses. Now, having children below the age of 18, this is a very big percentage. Of course, in our Monday editions, we've talked about how children are suffering from mental illnesses at school, and what teachers and the other stakeholders in schools can do to ensure that these children are supported. But of course, this number is alarming, 22.9%. This is a very big number. Now, this might be one of your children. Have you ever taken time to engage them, to know what depresses them, to know what they go through, to know what traumatizes them? That is now a question for all of us, because much as we are busy looking for money, looking for school fees, we know it is a very busy season of taking children back to school. Have you taken time to check out their mental well-being? That is very, very important that you as a parent take care. But also, we are dealing with a population of 24.2% of the adults. Now, this might be you, this might be your brother, this might be your sister, this might be your immediate relative or your friend are falling under this 22.9%. Now, what have you done to support them? Or you only talk about them from a side and you just leave them to go. And when we talk about mental health, Uganda is among the few African countries with an arguably robust mental health policy. This policy was first inaugurated by Uganda's Ministry of Health in 1996. Why was it inaugurated? It was inaugurated to try to bridge the gap in healthcare service delivery nationally since its inception. The policy has undergone several revisions. Specifically, the policy was developed to 1. Ensure that mental health services were decentralized and integrated in primary health care settings. 2. To ensure that there is availability and equal access to high quality evidence-based mental health treatment programs. And thirdly, to encourage family and community participation in mental health care. And the other reason, of course, is to protect the rights and lives of people living with mental illnesses. And lastly, to end stigma and negative perceptions and attitudes towards mental illnesses. Now, this is partly one of the biggest problems, that stigma. We stigmatize people. We stigmatize everyone. It is really very, very absurd and unfortunate. However, we are glad that this policy exists, and probably it will help out. It will support. Of course, now know that healthcare, mental health services are extended to the primary health care setting according to this policy. Now, we want to get into the details of mental health. What is mental health? What causes the various mental illnesses? How do you know that you might be having a mental illness? Those are some of the questions we are going to, whose answers we are going to have in today's show. Join me as we welcome the one Lulimi Maganda Martin, who is a psychiatric clinic officer from Butabika Hospital. A very good evening, sir.
Yes, good evening, sir.
You're most welcome.
Thank you.
It's a pleasure having you on this show.
It's a pleasure to be on Family TV.
And we are glad to have you, to host you this evening. Now, we are looking at mental health, and you know, mental health is not something you just bump into. It is something wide that even the victims don't know that they are. At one time, we hosted someone here and told us everyone might be a victim, but just because your level has not reached the other level that qualifies you to go to a place where you work from. but also to clear the air, maybe we start from the kind of patients that you receive at Butabika.
Yes. Yes, good evening to everyone. I'm happy to be on Family TV. Yes, Mr. Mukalazi. The kind of patients,
yes.
It is not something small. The patients are in different categories.
Okay.
Yes.
What are some of those categories? Because, you know, when you talk about Butabika, like I said earlier as we beginning, when you talk about Butabika, even if it is your place of residence, someone immediately thinks that maybe Butabika is only hosts people with mental illnesses.
Anyway, Butabika is a national referral hospital. A national referral hospital, but majorly specializing in psychiatry or mental health or illness. Yes, it receives all nature and kinds of patients, even with the general physical illnesses, malaria. But 90% is the psychiatric patients, the patients with mental health problems. Yes.
Well, let us look at mental health broadly. When you talk about mental health, what does it really entail?
Mental health is a very complex aspect. There are two components, mental and then the health. Yes. So to break it down to a layman's understanding, you look at mental health. Mental is if you are to define mental, these are complex activities which the brain carry out. Usually when you look at mental, you're talking about the brain. You talk about activities like thinking, judgment, decision making, memory, per se. So long as something has to do with brain activity and functioning. Now when you look at health, what is health itself? Health is the complete well-being of an individual. Okay? It enables an individual to say that Mr. Edwin is healthy. That means Mr. Edwin can function normally, can be able to move without any disability. So basically, so if we combine both mental and health, that's what we get. So you look at an individual who is you look at the psychological bit, the emotional bit, and then the social bit, where an individual is able to function normally in society, think, learn, socialize. You get it?
Yes.
And then be able to even cope up with the stresses of the normal daily life, because life is all about stress.
Yes.
So any individual who is able to cope up with the stresses of life, function well, socialize with other individuals well, yeah, we call it that mental health.
Oh, now there's something I'm getting out of this, that it is a compilation of the psychological,
Yes.
the emotional, and the and the social. Sorry, and the social. Now, just to give it more flesh, that how does it coordinate? How does it correspond? Because now someone would say, okay, socially, I might be having challenges socially,
Yes.
but psychologically, maybe they are okay. Or psychologically, but they feel they are okay. In society, they judge themselves as people who are okay.
Mr. Edwin, if I'm to break it further.
Yes.
To you.
Yes.
So, you, even a normal person can be able to tell someone has a mental problem. It is as simple as that. You all you get it?
Yes.
So, however much I can say I'm quite well, you can tell and judge according to the character or the behavior I'm exhibiting at a particular time.
Yes.
Now, for example, mental health is where you have an individual. I say, this individual can be able to tolerate and cope up with the normal stresses of life. The normal stresses of life, I'll give you an example. If I lost capital today of my business, I lost capital in my business,
Yes.
will I be able to cope up? Grief, then go back to normal life? Or is it going to break me down? Is that clear?
Yes. Yes. Now we are on the same page.
You get it?
Yeah.
Yes. Am I able to socialize with my neighbors appropriately?
Without carrying my burden onto them.
Leave along the burden. We are leaving the burden behind. Now I'm saying social. I'm trying to bring the social perspectives in. Am I able to socialize normally with my colleagues?
Even when something has happened to me, but it seems normal.
No,
when I'm talking to them.
Look at it in this way. You have neighbors.
Yes.
Okay.
Yes.
And are you able to cooperate with the neighbors? Are you living positively with the neighbors?
Yes.
Okay. Are you this person who wakes up and disorganizes the entire village? You get it?
Oh,
Are you this individual? Family A is complaining about molesting children. Family B is complaining about stealing. You get it?
Yes.
So the
that is social
part is that you can be able to live normally with others
Yes.
and happily
Yes.
with others,
Yes.
even with difficulties. You get it? Then the emotional bit. Okay, are you overtaken over with your emotions, or do you control your emotions? So a normal person is supposed to have emotions, but if you break down, it means you can't control these emotions, be it the happiness or the sadness. So if you manage, if you can live within those three perspectives, then we can say Edwin has good mental health.
Oh.
Okay. you are able to live well with others positively, despite the fact you have difficulties in
because they're normal. Everyone has their own. Yes.
Then, besides that, are you even able to control your emotional perspectives? Okay, emotional, be it love, be it happiness, be it sadness. Okay, are you able to live within that you grieve and then move on to the normal life? Are you going to grieve for 10 years? Are you going to break down always? Are you going to be emotionally weak to people and intolerant to people because you have a problem? Yes.
Now I think I now get it clearly, and I believe someone watching us is also getting it more clearly and in a more simpler way, like you've put it. But we look at now a situation where, for example, I've lost someone and I mourn for 6 months. But we also have someone who has a capacity of mourning for a week and then they move on. But me, I feel every day I still carry that grief on me. So I mourn for a year or 6 months. What? Now, does it mean that I have a problem with my mental health?
Okay. You said grieving for over what?
6 months or more.
6 months or more. Then probably you can.
And then I compare myself to someone who grieves for 2 or 3 days, then they move on.
Well, 2-3 days will be soon. Yes. Okay. But 6 months is much for a person to grieve. We've all lost our loved ones, I guess. Have you grieved for over 6 months?
No, I mean, I just imagine, I've seen someone who has had that as an issue. They're still grieving. Every time they cry, they break down and do that.
That individual needs help. Okay, 6 months is way too long for someone to grieve. Okay? Okay, it depends on how he or she behaves. Is he emotionally intolerant to other people? Does he or she cause a problem to other people when he or she is mourning? Because you can mourn internally and be like, okay, I lost maybe my mom or my father, but you are able to function normally. Okay, but if it affects your social, occupational functioning, then that is not grief now. This is something else, and you need help.
Before we get to something else, still I have now another category of people. We've attributed this to people's temperaments. Now it's you to now tell us whether it is really a mental challenge or it has something to do with temperament. We have people who, when they're angry, for example, someone can carry this microphone, throw it to the neighbor, or break glasses and destroy a lot of stuff because they're angry. And then afterwards, they get to their normal senses and they move on.
You see, with mental illness, there are very, very many conditions in mental illness.
Okay.
Yes, but being irritable and so exhibiting aggressive behavior is not part of a normal life. Okay? If Mr. Edwin has annoyed me, okay, it is normal for me to get annoyed. Okay? But if I react more than a normal person would react, for example, if you annoyed me, I would confront you. Okay? I may confront you and then have an argument, then it ceases. But if it involves now physical exchange, okay, being over the board, basically, if you are over the board, then we look at issues. Probably you have anger management issues. Probably you have a condition also which is compelling you to behave abnormally, aggressively, but there are a lot of other factors we consider before we come to that. Okay, so you look at the nature of the irritability, what causes the irritability. Okay, because you can annoy me, I can fight you, but if I'm over the board, then we need to look at other perspectives. What caused this? Do you have a history of it? Is it been coming for some good time? Or you get it?
Yes. Wow. You know, like you said as we're beginning, that mental health is really broad and complex. I'm realizing that it is indeed complex, and actually people need to have this information.
Yes.
There is a lot that needs to be talked about mental health, because I realize people need to know really a lot about mental health. Now, like what you've just talked about, and there are things we treat normal.
Yes,
We think that is normal. And maybe let's take a short commercial break. When we return, we are going to get into a little more detail of our topic today. Stick with us.
Family TV, enriching lives. Family TV, enriching lives.
Family Hour, empowering families one episode at a time. Together, we build strong, healthy, and thriving families with our daily dose of inspiration and expert insights on topics that matter, like education and career growth.
A child may be a good entrepreneur, but you're forcing the child to make sure that she passes sciences in order for her to be a what? A nurse.
Family health.
No one should one day tell you that, hey, since you have diabetes, you should not take Caro. That's a lie. There's what we call portion control.
Finance and wealth.
Keep track of your spending. And part of the spending, of course, as we said, be able to separate wants from needs. That's secondly.
Leadership and governance.
There are people who take on the political aspect and try to water down important, significant decisions we leaders take for the good of this country.
Not forgetting parenting.
Now you're raising kids or children who are in a totally different time. You get it. Those days your mother would just give you an eye and you know this is a problem.
Hey, there are visitors.
And it's just there are visitors
and
around.
Mom gives you this eye, you know?
Yes.
Catch more of this every Monday to Friday at 9 p.m.
Welcome back from the commercial break. This is Family Hour. We are exploring the dimensions of mental health, and we cannot talk about the dimensions of mental health without looking at the magnitude and prevalence of mental health? Because sometimes when you talk about these things, you may think, simply because it's not happening to you, it's not happening to your immediate relatives, so you think it is something normal that we walk away with until you step into Butabika. Let us let our guest share with us the details. Martin, yes. Please share with us the magnitude of mental health so that someone can really know that it is really a very serious problem we have in Uganda.
Yes. Now, if you look at Uganda as a nation,
yes.
Last time I was reading some information from UBOS. Uganda is one of the smallest countries, I think, in Africa and world at wide, and it has about 263 square kilometers. Yes. Now, in that geographical location alone, currently we have a population of about 45
approximately
45.
We are yet to confirm after the census in May.
After the census. But the current records show we are about 46 something. Now, out of that number of people, you find that about 55% are below age of 18.
Yes.
Okay. Yes. And if you look further, if you look at the statistics of mental health, you see that 24% of those young people below 18 have a mental illness.
And that is a very big number.
Yes.
That is a very
approximately
big number.
23%. Then in the adults, 24%. Now imagine you have a class of 100 students. It means, and those students are below age of 18 years, and you have 100. It makes it about 23 out of that 100 have a mental illness. Okay? And then you find that, again, in the adults, 24%. That makes it 24 out of 100 people.
Yes.
So wherever you are 100 people,
24.
Some 24 have a mental health problem. And the major illnesses basically are the anxiety and the depression. Yes, anxiety, people are scared of something they don't know. Some people fear spaces. Some people cannot even hold a discussion in a group of 5. Yeah? You get it? Some people have issues concentrating even in class where there are masses of people, even moving around, even eating. People have difficulties eating. You find certain people are eating more than they should eat. Certain people fear even to eat some certain foods and they are starving. Okay, those are anxieties. Then you find...
this is something broad. I'm now realizing that sometimes we limit it to a few things. But it is even broader than that.
Yes. So anxieties are basically affecting a lot of people. And then the other thing is that in every 4 people, one person has a problem, either depression or
anxiety.
And the adult people. Now, remember there's a recent study which has been making rounds in the news. Is it 14 million people have? Yes. If you look at it in that way, it is true. But the challenge is some people don't realize they have a problem. And there are problems people don't consider. So long as a person has not destroyed property, assaulted people, threatened or acted
has not moved out with a panga to run after people.
Has not undressed. Some people, maybe Martin is stubborn. You get it? These days Martin is very quiet. Martin has not gone to school for 2 days. But we don't usually get time to really know why Martin is doing this and this. Okay? It is not until it escalates to the other violent, undressing, those radical behaviors that people now find it. There is a problem. But now Martin has been exhibiting.
it starts from here.
Yes.
And then it goes there.
Yes, most of the issues, especially in adolescence. You find adolescents behaving abnormally, but we find it normal. That man is stubborn. There are some parents.
Yes.
You even tell
you know?
Exactly. You even tell the siblings. Don't joke around with that. You get it. So there are those issues. So the ones we think are mental illnesses, those are chronic, and maybe people have shown behaviors that we really think are out of norm. But there are those small things we don't consider.
We have people who speak, sorrowly. For example, someone is seated in a taxi and then out of the blue they busted. And then is that attributed to also one of the signals that you have a problem with your mental health?
No, like at the beginning I told you, mental illness is very complex. Sometimes a single sign or symptom cannot really bring out the illness unless we observe this person for some time. That's when we should get to know. But back to the other prevalences.
Yes.
You'll find that men are more affected than women. The reason is, as a man, and as we are growing up as boys, there is this societal thinking on men or boys. Men are strong.
Yes.
Okay, courageous. Men should not cry. Imagine finding a man crying. People will be like,
a weak one.
A weak one. You get it. But if you are not able to express your emotions, you keep on hiding emotions. If you are not able to speak out what you feel, it's a burden, and that has really affected men. That's why you see suicide is more in men than women, because women always cry. Women always want to express their emotions, but men sometimes are not allowed to do it because you seem weak.
Society and culture.
Yes, culture will look at you as a weak individual. Why is not crying? Men don't cry. You get it. So I would advise men, please cry and seek help.
If it is what will heal you.
Yes. Just let those emotions out. Don't sit back because you think people are going to judge you, you are weak. Okay? Find someone, talk to someone. Okay? Bring out those emotions. So you'll find that men are suffering more than women. Yes. Then, if you go back to the other prevalence, you look at mental illness is so big. Like, to bring it first is that it is a big problem more than people even understand it or get to know it. For example, there are some cultural perspectives. Okay, a person comes and tells you, for example, in depression, most of the people having depression are regarded to have you get it. This individual is suffering, but people think
you need to go and put right
appease
the ancestors.
And the ancestors are coming back. Probably he did something
to haunt you.
Yes. So, and sometimes these people recover and go back to society. But then the problem is within the next episode. The more episodes you get, the more severe it becomes. You get it.
So it is possible that some of these come in series. So series 1 comes, and you heal and you feel it is over.
Yes, because there are some protective factors as individuals we have.
Okay.
For example, you are able to tolerate some pain and some stress. Some individuals cannot tolerate such. Okay? Mr. Adrian, you may be able to go and witness an accident down the road there.
Yes.
Then you'll be like, oh sorry, these people are really, you get hurt. There are people who will go back home, will not sleep, will not eat.
You'll even have hallucinations in the night.
Start having nightmares. And not for 1 or 2 days, but for over a week or 3 days. The events keep on coming back. Whenever I get such scenarios, some people will even stop boarding taxis because you saw someone boarding a taxi and get an accident. So all that is mental illness. I said, okay? People will not realize it. Be like, there are some people who even come and brag that I usually get information from the ancestors whenever I'm going to board.
Yes.
Okay?
They warn me.
They warn me.
Yeah.
When I see, you see, there are some things also, the superstitions also come and hunt us. And I see a cat, I don't go that side.
Yeah.
Okay? So imagine a person who sees a cat in the morning and doesn't go to work, stays at work. I mean, stays home.
The devil is a liar.
Says there are people who even say, if you meet a woman, the first person you meet is a woman,
then that is a bad day.
A bad day. Don't go to work. People go back and sleep. Really. So there are very, very issues there. And the challenge is that people look at hospital as Butabika.
Yes.
Yeah? That's where they judge the mental illness. But society.
So if you've not yet been to Butabika, then you're not yet there.
Yes, but a lot of people are moving with mental problems, health problems, and they need help. They may not need medication. Some may need just one-on-one session with someone. Okay, reassurance. Okay, family support. But if you don't identify it and you leave it hanging, probably it will develop into a serious problem.
Meaning all these serious problems we see started as minor and neglected.
Yes.
And then they advanced.
I'll give you a common example. You always move around town.
Yes.
Then you're seated in your car. Out of the blue, a border man comes and starts banging your car. Well, what's that? And he starts even abusing you from nowhere. You've not spoken to that gentleman. You've never seen the gentleman. Yeah? Then you're like, but where did this man get all this anger from? Okay. So people have issues,
and you know this is common and very common, and you know we undermine it.
Yes.
You end up saying I'm a border, and you leave it at that.
Yes, you even that's the right thing. So it's same. But I don't want to use that. So probably they stabbed. They have something burning inside them. You get it. You are there, a Buddha guy comes, abuses you. Like I was watching a guy just out of the blue went and slapped someone. There's one TikTok video I was watching from someone's phone. A guy was seated on top of the truck. One just came and just loosened the seat and the person fell down. And this man moved on gently, happily. Very happy. I've made him fall. That is a challenge also. Okay? So if we neglect those things at the beginning, we may say, oh, you are fujo. It's just stubborn. But stubbornness has a limit also. I may be stubborn, but there is a limit to being stubborn. You get me? So there are a lot of issues going on. Then there are issues, a person starts, probably, this is not more of a mental illness, but if neglected can also go to a mental illness. For example, a person who has epilepsy fits. You find a home, there is a home I know of. They called me. They had locked this 7-year-old. They even built a carpet like, like a small, so they would keep him that side. The reason is they don't want him, that they fear that if his saliva mixes or is touched by these other siblings, they are going to develop epilepsy.
Still stigma and
paying what? Sacrifices. And so at the end of the day, you find the hospital explores with those severe cases. So by the time these people come to hospital, it's much worse. So
wow. Let us look at some of the causes of these illnesses. Of course, we've looked at some of the examples of the common examples that someone would look at as red flags. But what are some of the causes?
Well, the causes, you see, there is a lot we don't know about mental illness. Okay? But so far, the small we know, or the little we know about mental illness. Because it is not just a singular cause that brings mental illness. It's a complex of events. Okay? For example, let's start with a young, a child. The upbringing itself. Yes, the upbringing. The upbringing.
Talk about the upbringing, because now
yes, you have a son, a daughter, and you really love this daughter. You're pampering this daughter to the bits. Okay? You're buying lots of gifts for this daughter. You don't want to subject this daughter or son of yours to normal, let's say normal circumstances and stresses. Yes, okay? You want your kid to have food always on the table, leave the plate on the table. Okay, after eating, a maid is there to shower the kid. Okay? A maid is always there to carry the baby when the baby is crying. When the baby comes and cries and asks you, Dad, I want this, you buy. Okay? Then what are you like grooming in that child?
I'm giving them good life.
Well, that's not good life. You're over pampering. This kid will not be able to tolerate normal stresses of life. Okay? This kid, a mere distress like this will break down this kid. Okay? Because he's used to being pampered. He's just used to being in that soft life. I'm not saying that you should go to the extreme one. Yeah? Yes. And that one also has a disadvantage of being so rude. And if you are to punish, you don't punish with these hard punishments like caning, being aggressive, you shout at the kid. Okay? That one also is detrimental to the kid. Okay? So you need to always have moderate parenting. Okay? This is what we call you have to give this conditioned love. Okay? A reward. And so if a kid disappoints you or makes something, at least tell him over, I'm going to punish you. You're not going to watch a cartoon until you finish your homework. Okay? You're not going to have this until you finish your homework. Then if a kid performs well, at least gift him something. Okay? So the kid will know that, hey, you work for things. Okay? Then if you are becoming rude, you are subjecting this kid to harsh environment. Okay? And this harsh environment means he will learn that for you to survive in life, you have to be aggressive. You have to always shout. Okay? Daddy, some kids are daddy wange, but you've never been to any of those.
Some even go ahead and give them names.
Yes.
Sergeant, corporal, and what?
Exactly. So that one also affects the kid. There is a condition called post-traumatic stress disorder. Okay? So there are individuals who are subjected to that. For example, child abuse. Child neglect. Okay? Those ones, when a child is growing up, child neglect, abuse. Can you believe there are people who molest children?
So, from previously, Namirembe Diocese held a youth conversion, and the Psychiatric for Navagereka have exposed, those three specifically have really exposed a lot of nasty things that happen to children in homes.
Now, do you know what will happen to that lady? Have you seen ladies who come out and say, I don't want a husband. I don't like men. I'd rather be single. I'm independent. And you think that one just comes out of the blue? They've seen their fathers misbehaving. They have seen their fathers abuse probably their mothers. They have, so
in fact,
a child grows up.
One of the girls said, it was better if my dad died yesterday.
Exactly. And you think that kid is normal now? Kids need rehabilitation. By the look of things, that one also causes it. Then you look at the other exposure to some material, for example, drugs and substance, okay? Alcohol, marijuana, cannabis, salt, opium, okay? Even these prescribed medications. There are a lot of people who have had chronic illness, who are prescribed some painkillers perhaps, and these people have become addicted to painkillers and they cannot live with painkillers. That is also a mental health problem. Okay? This person will go to all odds to get that medication, and it is affecting his occupation. If he doesn't have those, it does not work. He utilizes most of his resources to buy such substances. Okay? Then there are these ones who are, for example, like we've discussed, they grew up in those broken families and on the streets and abusing substance. Okay? You find them nicknaming their names, Schwarzenegger, and they have these black knuckles, they are beating people around. You get it? Then the other can be, we've passed through that. Then the other can be, genetics also plays a role. Yes. Genetics plays a role in such illnesses. If in the family you've had subsequent members having mental illness, there are high chances that the next generation will have some other people with the illness.
Even without these factors you've talked about.
Yes. So those people may live positively without the illness, but if they get these triggers come in. So like I told you, it's a combination of various factors. Yes. This illness will come in. Then the other is the chronic illnesses. Those chronic illnesses, for example, diabetes, cancer, syphilis, HIV. Okay, those ones are going to cause mental problems to an individual if not treated or if they're not supported well. Imagine a kid who was diagnosed with HIV when she was 6'5", and she has been on medication for the last 20 years. Okay? So perhaps she will have depression, she will feel she's not loved enough, she will ask questions, why me? Why others are free, why me? You get it? So at the end of the day, you get psychological disturbance. Remember we talked about the three perspectives, psychological disturbance,
emotion and social.
Yes. Okay? So she can even break down emotionally. She will be happy during days with the cracks, but when she goes back to bed, why me? Others are HIV free, why me? Okay? Then there are other issues like trauma and accident. So you're normal, but you walk down the road, you involve yourself in a border accident, then you have a head injury, then the brain is affected. Okay? So you can also have a mental illness through that.
Wow, I think we cannot go beyond this point, but what are your closing remarks before we wind up this discussion for today?
I want to thank you for this opportunity. Yes, the management of Family TV. Yes, this is good. You are contributing to the mental health of basically mental health and mental illness awareness, because I think a lot of people are watching this thing. And I would encourage more of this. Yes, I would encourage more of this, and yes,
thank you so much, Martin, and to your viewer, thank you so much. Now, in case you have any question, in case you want to understand anything, we shall have Martin back next week on Tuesday. So go through our social media platforms on Twitter, on Facebook, on Instagram, and on YouTube, because this show is on YouTube. So you can as well send in your question, or you can use our official WhatsApp numbers, and your question will be responded to next week. Edwin Austin Mkalas is my name. Tony Raymond Tonena, we have Muhumuza in transmission, Brinko, and the entire team. It's a good night. We meet again tomorrow, same time.